OET Writing, Medicine Writing 1, Error Correction, John Beattie Transfer Letter. These OET Medicine Writing case notes and sample letters are taken from OET tests. Listen to the case notes being read, pause the video, read the case notes in 5 minutes alone, write the letter in 40 minutes, find the errors in the sample letter, and compare your letter with the sample letter. Good luck. Mr. John Beattie transfer letter. Let's read the task first. Write a transfer letter to Mrs. Keller, care home manager, outlining Mr. Beattie's relevant medical history, hospital treatment, and ongoing care needs. Address the letter to Miss Barbara Keller, manager, Green Acres Care Home, 200 Green Street, Newtown. As always, you need to expand the relevant notes into complete sentences. Do not use note form, use letter format, and the body of the letter should be approximately 180 to 200 words. Assume that today is the 4th of July 2020. You are a hospital doctor on a geriatric ward and an elderly patient is now ready for discharge. Name: Mr. John Beattie. Date of birth: 23rd of March 1930. 90 years old. Address: 20 New Street, Newtown. Social background: labourer, retired. Widowed. Wife died 2 years ago, now lives alone. 2 sons: Bob, 46 years old, lives 500 kilometres away with 2 children. Sean, 42 years old, divorced, lives 10 kilometers away, has MS. MS is multiple sclerosis. Walks with a cane and wheelchair used sometimes. Caregiver visits 3 times per week and helps with activities of daily living. A cleaner visits 1 time per week. Mr. Beattie is interested in watching sport on TV, particularly football. He has no family history and he is allergic to peanuts. Past medical history includes hypertension in 1982, osteoarthritis of the right hip in 2008, osteoarthritis in both knees in 2010, and coronary artery disease, CAD, in 2015. Today is the 4th of July 2020. Current medications include enalapril once a day for hypertension, paracetamol twice a day for osteoarthritis, and ACE inhibitor benazepril 30 milligrams per day for the coronary artery disease. Hospital treatment record 1st of July 2020, 3 days ago. Admission to the emergency department. Subjective pain 7 out of 10 on the left side. Fall in kitchen found on the floor by a caregiver. Objective: blood pressure is normal, 120 over 80. Pulse 78 beats per minute. Basic metabolic panel normal. Height 163 centimeters. Weight 75 kg. BMI 28, healthy. Diagnosis: minor trauma, bruising of the left hip and left arm, as well as a laceration. Laceration is a cut above the left eye. Hip and arm fractures have been ruled out. Plain X-rays. No sutures required. Current medications continued. On the 2nd of July, Mr. Beattie was transferred to the geriatric ward and was recovering well. A discussion with the patient: wishes to live with either son. He has lost confidence living alone. The 3rd of July 2020, discussion with sons. The father, Mr. Beattie, has an increased fall risk. Therefore, the discussion is about putting him in a care home. Bob, who is the elder son, cannot care for his father because of the distance and his two children. Bob suggests local care home for immediate care. Long-term residential solution can be arranged later. Sean wants to care, but he is prevented by his multiple sclerosis and eventually agrees to putting his father, John, in a care home. The 4th of July, which is today. Patient agrees to care home. Immediate care plan. Monitor medication compliance. Wash laceration with soap and water only to stop infection. Hospital physiotherapist to visit twice a week and provide exercises to increase range of motion in the left hip and arm. Note: geriatric ward outpatient clinic appointment in 11 days on the 15th of July, transport to be arranged by the care home staff. The plan is to write to the manager of the care home. So in a letter like this, it's very important that the discharge plan notes are made clear to the reader of the letter. In this case, that is Mrs. Keller, the care home manager. Here are the writing assessment criteria, which are essential for you to know and understand. Pause the video and read them. Here is a suggestion for how to plan the OET writing task. Pause the video and read. Pause the video, plan and write the letter in 40 minutes. Pause the video and find the 33 errors in this letter. Pause the video again and this time correct the errors in red. Watch the error correction. Miss Barbara Keller needs to be capitalized. Names are always capitalized. Green Acres Aged Care Home also needs to be capitalized. Street is spelt incorrectly. Newtown, 4th of July 2020. Dear Miss Keller, Keller is spelt incorrectly and should have two L's. Regarding Mr. John Beattie, John is also spelt incorrectly. Be very careful that you spell the recipient of the letter and the patient's name correctly. I am writing to request, not requests, I'm writing to request. With to, we always use the infinitive of the verb afterwards. To request, to provide, to care for, to eat, to drink, etc. I'm writing to request ongoing care of Mr. Beattie before suitable long-term residence can be arranged. Mr. Beattie continues to recover from a recent fall. not falls because it's singular. We have a here, so a recent fall, and is at high risk, not high risks of further such events. Although his two sons is supportive, two sons is plural, so this should be are supportive. They are unable to care for him on a permanently basis. This is an adverb, it should be an adjective, permanent basis. Mr. Beattie was admitted to hospital. Mr. Beattie was admitted to hospital. This is an important sentence and phrase to learn because you might use it in a lot of letters. Mr. Beattie was admitted to hospital on the 1st of July. Follow his fall. It should be following his fall. He had suffered a laceration above her left eye. Mr. Beattie is male, so it needs to be his left eye, for which no sutures, should be plural, were required. This will need to be washed once daily with only soap and water to prevent infection. Once again, we have to, so the verb should be in the infinitive form, the root form, the base form, form 0. Although no fractures had been sustained, there were bruising to the left hip and arm. So bruising just gets was. There was bruising to his left hip and arm, and a physiotherapist, this is a small spelling error, therapist with an I, from the hospital will visit, not visits, will visit Mr. Beattie twice a week, once again, to provide exercises to increase the range of movement in both. Both refers to the hip and arm. It is worth note, so we would say it is worth noting that Mr. Beattie suffer. Mr. Beattie is the third person. I suffer, you suffer, he suffers from osteoarthritis. Hypertensive. Hypertensive is an adjective. We need a noun. So it's hypertension. He suffers from hypertension and coronary artery disease. These conditions should be plural, are controlled by 1 tablet of enalapril, 2 tablets of paracetamol, and 30 milligrams of benzapril every daily. So we don't need to say every daily. We could say every day or just daily. In this case, daily is better. He will need assistance to comply. Once again, comply follows to and should be in the infinitive form with this regimen. Finally, this is important because every letter pretty much has this phrase. It would be appreciated if you could, not organized, just organize, transport for Mr. Beattie to enable him to attend, once again, to attend his geriatric ward outpatient visit. And yours sincerely should be yours sincerely. So that's it. This is a good letter. Pay attention to the paragraphs. You have 1, 2, 3, 4, 5. You have 3 main paragraphs. 1, 2, 3. You have the introduction with the purpose, and you have the final closing sentence with a request. Please note the space between the paragraphs and also note how the paragraphs start. Mr. Beattie continues to recover. Mr. Beattie was admitted. These conditions are controlled. Finally, it would be appreciated. The structure of the letter is introduction, situation, background, assessment, and request. That's it. I hope you learned something. Pause the video and read the error-free letter. Please like this video to help me build this channel for you. Thank you for watching. Good luck with your studies. Stay motivated. You can do it.